Welcome back, everyone, to another episode of the EMS Quick Byte podcast. I'm Chris.
And I'm Jamie. Today we're diving into a topic that hits close to home for all EMS providers: workforce safety and wellness, taking care of our own.
That's right, Jamie. In EMS, it's easy to get caught up in caring for others. But if we don't take care of ourselves first, we won't be able to provide the best care for our patients. This episode is all about recognizing the hazards we face, both physical and mental, and learning how to stay resilient in this high-stress job.
Absolutely. Chris, the work we do can take a toll on both our physical health and our mental well-being. It's critical to understand how to manage that stress, maintain balance, and take precautions to prevent injuries and illness. Let's kick off with the foundation: general health, wellness, and resilience.
So, Jamie, when we talk about wellness in EMS, what exactly do we mean?
Great question, Chris. Wellness refers to the active pursuit of good health, both physically and mentally. It's about making conscious decisions every day, eating a balanced diet, exercising regularly, and making time for adequate sleep, all while building positive relationships with colleagues and loved ones.
Right, it's a holistic approach. And let's not forget resilience, the ability to recover from distress and bounce back stronger. That's crucial for EMS professionals dealing with trauma and high-stress environments.
Exactly. Some key strategies include maintaining a healthy diet, making sure you get 7 to 9 hours of sleep per night, and incorporating movement and stretching into your daily routine. These practices build not only physical resilience, but also mental toughness.
We all know that stress is part of the job, but not all stress is bad. There's actually something called eustress, which is the good kind of stress.
Right? Eustress helps us stay focused, boosts our energy, and can even increase job satisfaction in the long term. But then there's distress, the kind of stress that leads to burnout, mental fatigue, and even physical illness.
And that's where stress management comes into play. Whether it's changing work hours, finding a partner with a more positive personality, or even cutting back on overtime. These are all strategies that can help us manage distress and prevent it from overwhelming us.
Don't forget about the importance of talking about your feelings, seeking professional counseling when necessary, and expanding your social support system beyond just your coworkers. Sometimes just having a conversation with a friend outside of work can make all the difference.
Sleep, or the lack of it, is a huge issue for EMS providers. Studies show that about half of us get less than 6 hours of sleep per night.
And that can lead to serious consequences. Everything from medical errors and vehicle crashes to long-term health problems like hypertension, diabetes, and even depression.
So, what can we do to combat fatigue? First and foremost, aim for that 7 to 9 hours of sleep whenever possible. And during shift work, take advantage of any opportunities to nap for 20 to 30 minutes. It may not seem like much, but those naps can really help stave off fatigue.
Another great tip is to be mindful of your caffeine consumption. While it can be helpful in small doses, too much caffeine can actually disrupt your sleep later on. And of course, staying physically active and engaging in mental exercises like playing games or having a conversation can also help keep you sharp during long shifts.
One of the biggest hazards we face in EMS is exposure to infectious diseases. That's why personal protective equipment, or PPE, is non-negotiable.
That's right. Whether it's gloves, masks, face shields, or gowns, using the proper PPE can literally be a lifesaver. Donning and doffing it properly, in the right sequence, is key to reducing contamination risk.
And let's not forget about hand hygiene. It's the simplest and most effective way to control disease transmission. Always wash your hands before and after patient contact, even if you've been wearing gloves.
Yeah, hand washing is the gold standard. And in situations where there's no running water, make sure you have a waterless hand washing substitute on hand.
Mental health is just as important as physical health. We deal with difficult situations daily: trauma, death, sometimes even violence. And that can take a toll on our mental well-being.
Post-traumatic stress disorder, or PTSD, is something that many EMS providers face. Critical Incident Stress Management, or CISM, is a structured way of dealing with the stress after particularly traumatic calls. It's important to recognize the signs early and seek help.
And let's be real, there's no shame in asking for help. It's critical that we normalize seeking support, whether it's through peer counseling, professional therapy, or CSM programs. That's all the time we have for today's episode of EMS Quick Byte. Remember, taking care of others starts with taking care of yourself.
Thanks for tuning in. Stay safe, stay resilient, and we'll see you next time on the EMS Quick Byte podcast.
And don't forget to subscribe and share with your fellow EMS professionals.